Here's everything I wish someone told me before nursing school so that you don't have to learn the hard way. Hi everyone, my name is Brianna. Welcome back to my channel. This video is the first in my new productivity series called Everything You Need to Know, where I teach you something I've learned while I do something productive. And today I'm going to be cleaning and organizing my closet, which as you can see is long overdue. If you're a busy person like me, feel free to play this video in the background while you do something productive so that you can both learn something and cross something off your to-do list. Without further ado, let's get right into the video. Okay, first things first, you're gonna have to take prerequisite courses before you get into your nursing program. For example, my school as a freshman, I wasn't in my nursing program yet, I was in prerequisites. So anatomy, physiology, sociology, psychology, math, English, writing, speech, whatever those courses may be, you're going to have to complete those before you're in your program. And even if you're a direct admit student, as a freshman, you're like already in your program, almost all universities have nursing students take anatomy and physio. Now, anatomy and physio are some of the hardest, if not the hardest classes you will have to take in your entire undergraduate program. So I can make an entire video on how to study for those courses and how to study in general, but you're going to be spending like 80% of your time studying anatomy and physio. These classes have some of the highest fail rates just because they are so difficult. And listen, I took anatomy in high school. High school anatomy and physio is nothing compared to university. Even if you took AP, which I took AP anatomy, it's nothing. It's not the same. I would say my best recommendation for passing anatomy and physio is go to mentoring sessions or tutoring sessions as often as you possibly can. I went, so my university offered free mentoring, free tutoring, and a lot of universities do offer this. It's not really free, it's included in your tuition. So I would look up at your university if you have resources like that because I found them to be extremely helpful. And even if I felt really comfortable on the subject we were talking about, I would still go to these sessions because you can do one-on-one sessions, you can do group sessions, and a lot of times they'll give you like practice questions because they've already taken the course. They know what it's like. In fact, I loved going to mentoring sessions so much that after I passed anatomy, I became a mentor. So I couldn't recommend it more. Also, a lot of the times in your textbooks, there's practice questions at the end of chapters. And if not, we are in a day and age of artificial intelligence where you can submit your lectures into ChatGPT or whatever AI platform you use and say, create nursing style questions for me, create a practice test for me, and click style questions for me. I use ChatGPT all the time for that reason. So even if you don't have mentors, you don't have tutors, you don't have practice questions in the end of your textbook for some reason, there are so many resources out there, YouTube, AI, that will supply you with practice questions. I guarantee you if you look up on Google right now, anatomy practice questions, something will pop up that you can use. Another thing is if you're struggling with a concept and you don't have the resource of free tutors or mentors, go to your professor's office hours. I can't stress that enough because not only are you building rapport, building a relationship with your professor, but he or she knows that you are trying, you're actively engaging. When you ask for help, it just shows how dedicated you are. You're getting answers directly from your professor. Okay, once you are actually in your program, I would say the classes that people struggle with the most is pharmacology, which is drugs, learning about drugs, and probably microbiology. Some people take microbiology in their prerequisite courses. My university had us take it once we're in the program. My biggest recommendation with pharmacology is note cards, like flashcards, and using drug card templates that I can insert a picture of what those look like there. But with the templates, you write down its mechanism of action, so like physiologically how it works, what it's treating, interaction, so what drugs can you not mix with this drug, its considerations, what do you have to do? Do you have to check their pulse before you give this med? You have to take their blood pressure before you give this med? Does this med make them dizzy? So you have to make sure they're not a fall risk, etc. Some other classes you're going to take, like I mentioned, is microbiology, which is learning about like pathogens and like transmittable diseases and stuff like that. Which honestly, unless you're going into like vaccinations or public health, you won't need most of the stuff you learn in microbiology. You might not even have to take microbiology. And even though I don't need most of that information, I actually loved microbiology. I found it to be so interesting. You got to do like little experiments every lab. You got to wear the goggles, the gloves, the lab coat with your little droppers. I found it to be really fun. But I also had a really amazing professor, and I think that makes a huge difference on how much you like the class, obviously. But for microbiology, how I studied was a lot of times professors give you objectives at the beginning of every lecture or at the beginning of every class. They're just written down on the PowerPoint. And even if you don't, you can open up your textbook, and I guarantee you your textbook will have like objectives or key points, key takeaways that are listed at the beginning or throughout the chapter. And I would write those objectives down, and then as I went through the PowerPoint or through the lecture, I would answer those objectives in as depth as I possibly could. And I would write them down over and over and over again until I had them memorized. And I got A's on all my tests in that class. So again, I can do a whole other like hour-long lecture on the best ways to study for each course, but that's personally what I did. And again, if you're struggling in that class, I would recommend going to your professor during his or her office hours and asking for help. Other classes you're going to have to take is health assessment, where you learn how to do a head-to-toe assessment. And this was nerve-wracking for a lot of people because it's like your first class where you're actually interacting with patients or learning how to interact with a patient. And at the end of my health assessment course, we had to do a sort of simulation where we would assess a real patient. It wasn't a real patient, but it was a real person pretending to be a patient, not a classmate. You go into this simulation, you don't know the person, and you have to give them a head to toe assessment in under 15 minutes. The most things you can miss are two things. Otherwise, you fail, which sounds really intense, but I've never heard of someone not passing it. It is very intense and nerve wracking in the moment. And then retrospectively, it's like not that bad. But in real life, you will never be limited to only 15 minutes. I don't know why they limit us to 15 minutes. It might be different at your university, but do be prepared for that. You have to practice your head to toe assessment over and over and over again until you perfect it. It's the hard truth, but it is a truth, and this is why I'm telling you beforehand to prepare yourself so you're not caught by surprise. Another class you'll have to take is fundamentals, which is kind of just like entry into the hospital setting. You learn about different hospital devices like a walker, a cane, a bedpan. You learn about ulcers. You might learn about a little bit of dosage calculation. You have healthy populations, learning a lot about vaccines and like the general health of the population. Collaborative practice is another class I had to take in my first year, which is learning about how to interact with other disciplines like doctors, physical therapists, respiratory therapists, occupational physical therapists, and learning different tools you can use as a nurse, like SBAR, which is Situation Background Assessment Recommendation. And I can't think of other tools off the top of my head, but I can insert a few here, and you learn how to apply those in your practice. Moving on to something that everyone hates, which is ATI. It stands for Assessment Technologies Institute, which sounds like it wouldn't apply to nursing at all, but It is. It is a online e-learning platform that both prepares you and assesses your NCLEX readiness. And if you don't know what the NCLEX is, it is the state exam or the national exam you will take at the end of your undergraduate course. So after your 4 years, that will give you your license, essentially, your license to become a nurse. So the reason why everyone hates it is because it is much harder than your typical nursing school exam, and nursing school exams are already really difficult. So and this is on purpose. They purposefully make it harder than your typical nursing school exam. So for pretty much every course that you take in nursing school, there is an ATI exam associated with it. You have these proctored exams. They're mandatory for almost every class, and then there's also extra ones like nutrition and then pediatric, which you might have a pediatric course. I did not have a pediatric lecture. We only had 3 days of pediatric clinical, and that's it. We didn't have any lecture on it. And I had a pediatric ATI exam. I can list all the exams you're going to have to take right here if your school uses ATI. Some schools might use a different platform that is very similar to ATI, but I know a lot of universities today are using ATI. So when you take these proctored exams, they're not graded by percentages. They are, but you're ultimately graded on the level you get. There's 4 levels: 0, 1, 2, 3. 2 is meeting expected scores. Like if you get a level 2, you're performing as expected. Level 3 is above expected, exceeds expectations. And then level 1 and 0 is obviously below expectations. So I think for most ATI exams, it's around a 65 to a 70% is a level 2, which sounds like, oh, well, that's easy to get. I could get a 65%. Most people get level 1. My nursing school is ranked 13th in the nation, and most students in my cohort are getting level 1s. At my school, if you get below a level 2, so a level 1 or level 0, you have to retake the exam, but even your retake, it doesn't affect your grade at all. So you essentially retake it for no reason. A lot of people I know don't even try on their retake because it doesn't count for anything. I'm just being real honest. Most people don't try on the second take because it doesn't count for anything. And also, the first exam you take, or if you don't have to retake it, my university grades it very oddly. So if you get a level 2, you'll get a 9 out of 10. If you get a level 1, you'll get like a 8 out of 10 or lower. I'm not sure exactly. If you get level 3, you'll get a 10 out of 10. And then post exam, no matter what level you get, you have to do these remediation activities and this after exam quiz. So ATI will calculate what you did poorly on, and then it'll provide you with modules to go over to strengthen your weaknesses. And then you'll have a quiz that's like 15 to 20 questions after you do the remediation activities. And then you have to do that quiz, and you have to submit the quiz, and then you have to do a reflection. It's a lot of work, honestly, for not being a large percentage of your grade. It can be useful when you need it. For example, I've used the ATI modules to write some of my papers. That's like when I find it most useful. And it also does have a lot of helpful practice questions. So if you're just practicing, not necessarily for an ATI exam, but just for like your medical surgical course, your pharmacology course, there are modules and books and a lot of useful information when you're using it for that reason. But just to be blatantly honest, I've never met a person who likes ATI, the ATI exams, the ATI activities. Everyone collectively hates ATI. Okay, that was really all over the place. I could also make a whole other video on ATI, how it works. But for the purpose of this video, we're going to move on to the next topic, which is clinical, which I feel like most people are worried about. So clinical are typically 12-hour shifts. You start when a real nurse would start in real life, and most of these shifts are bedside nursing shifts. So if you're in nursing school and you're set on becoming an aesthetic Botox nurse, I'm sorry to tell you that you still have to do these clinicals. But it's worth it in the end because you're still going to be a nurse. You typically have to arrive at either 6 or 7 depending on what hospital system you're at. Typically 12-hour shifts. You get assigned a nurse and you are with that nurse the whole shift. You're just getting to see what they do on a typical day. Once you pass your dosage calculation, you'll get to participate in passing meds. So you as a student will get to pull the meds out of the drawer. You'll get to open them, explain to the patient what the medicine does, what it's for, give the medicine to the patient, which a lot of people are excited for. You'll also get to do all the other activities like helping the patient bathe, help them get dressed, help them brush their teeth, whatever they need help with. You as a student can do that. You'll learn about the IV drips, how to set up IV tubing, all sorts of things. One thing about clinical is you cannot be late. Many universities, if you're a minute late, you're going to get sent home. So do not be late. Be early always. Even on time is kind of pushing it. So I would recommend getting into the building at least 5 minutes early, if not 10, to make sure you have ample time to get onto your unit or get where you're supposed to be. I have never been sent home early. I've never been late. I've heard of people being 1 minute late and getting sent home. Watch out for that, especially if you have a mean clinical instructor. Just be early. Better to be safe than sorry. So when you're at clinical, I recommend participate as much as you can. The more you practice, the more comfortable you're going to be with it. And it can seem very daunting to ask the nurse in the middle of her doing a task, like, hey, can I try? But just do it. If the worst they can say is no, right? Sometimes you'll get a bad nurse you are assigned to, and some days are just like that. I've personally never had a horrible experience with a nurse. I've had days where I can tell the nurse is very busy and very overwhelmed, so I don't want to interrupt her in the middle of her thinking. But if it's a slower day, and even if you're not feeling confident, I would highly recommend asking the nurse, hey, can I try that? Can I pass the meds? Can I try pulling the meds out? Can I give the meds? Can I explain the meds? I can help the patient to the bathroom. I can help them get their bath done for the day, brush their teeth. And a lot of those things are going to relieve the nurse. The overall idea with that is just participate as much as you can, because that's how you're going to learn, and it'll be a lot less difficult for you after you graduate and get your first job if you did participate compared to if you never did and you just sat on the sidelines and never spoke and never asked questions. Another thing that I think makes clinical easier, that I think is a very controversial topic, is does having experience in healthcare or experience in a hospital setting make clinical easier? People are probably going to disagree with me on this, but yes, it does. I had previous healthcare experience and hospital experience before I went into clinical. I'm a bedside tech. I got the job my freshman year, and I was infinitely more confident going into clinical, talking to the patients, talking to the family, taking their vitals, just simple things that bedside techs do. In my first clinical, me and one other girl had been techs before out of the 10 of us. Everyone wanted to work with us. So like we would go in pairs to go grab the patient's vitals, go help them to the bathroom, give them a bath, so on. People would be so timid and anxious, which I completely understand because if it's your first time doing it, it is very awkward. As someone who was a tech, as someone who was a CNA in high school, I was so much more comfortable, and I would gladly take my classmates in with me, show them how to do it. I've heard a lot of people say that, oh, it doesn't make a difference if you are, if you have job experience or not in a hospital. I genuinely feel like those are the people who don't have job experience in a hospital. Okay, I am going to organize these boxes while I continue to talk about something called simulation. Everybody also hates simulation. It is probably one of the most anxiety inducing experiences ever. And you have to do it multiple times. You have to do one simulation for every course you take. Essentially, what it is, it simulates a patient experience, an in-hospital patient experience. It could be a mannequin or it could be a real person. If it's a real person, you won't be actually doing anything to them. Most of the time, it's just assessments, like a head to toe assessment and educating them. If it's a mannequin, though, you will be doing actual interventions. Like one of my first simulations was putting a catheter into a mannequin, like a urinary catheter. So that's fun. The reason why it's so anxiety inducing is because you are being watched and critiqued on your performance. You will be critiqued afterwards. So just be prepared for that. Me talking about it sounds like, oh, how can that be the most anxiety inducing thing ever? You just don't understand until you've actually done it. Everybody gets extremely anxious about these. Even the best of the best nursing students, the smartest ones, still get anxious about it. And that's okay. I think that's just part of nursing school. And I'm just being real and honest. You will be anxious about your simulation. The simulation I just had for critical care, me and two other of my peers were all three the nurses in there together. And our patient had a heart attack and coded. And I was the one doing CPR on the mannequin. So that was what the simulation was supposed to happen. The experience was that we assessed that the patient was having an ST elevation MI, a STEMI, which we did an EKG on the patient, which you will learn how to do an EKG when you are in your critical care or your MedSurg 2 course. As you can imagine, that was a very stressful experience for me because my patient was about to die. Most of the time, these are not graded. I've never heard of simulation being graded, even at different universities. It's just an experience. That makes it sound even more stupid. Like, why would you be nervous if it's not graded? I think it's just most nerve-wracking because you know you're being watched, so you don't want to mess up because both your instructor and your cohort are watching you from like a TV in another room. But I do feel like it gets easier the more simulations you do. So another thing that I feel like will be helpful for you guys is knowing what YouTubers to watch, because I made the most out of YouTube, especially in my prerequisite courses. When you're still taking anatomy and physio, some of the best YouTubers to watch include Crash Course, Dr. Matt and Dr. Mike, Amoeba Sisters, and Osmosis. You've probably seen like the Osmosis videos if you took high school biology. I'm sure that you've seen them before. This part of the video cut out, but I still wanted to tell you guys, YouTubers, once you get into your nursing program, Nurse Sarah RN, she is a fantastic YouTube channel. She does like a lot of whiteboard explanations, so she'll draw things out on a whiteboard, draw out charts, draw out cascades, and she wonderfully explains things in simple terms that you can understand. Simple Nursing, Mike Linares, he adds like a lot of humor into his teaching. He does a lot of songs to help you remember things. He does a lot of mnemonics and adds like, he's funny about it. So if that's what helps you remember things, I'd recommend watching him. Nurse in the Making, which she's more of a newer like Gen Z nursing influencer, I'd say. I know she has her own little booklet of like a comprehensive like nursing like guide, which I actually bought it. There's a lot of useful things in it. It's like the most like, essential things you need to know, but it does cover almost every course that most nursing students are going to take. Next is Nursing Institute. I haven't watched her as much as I've watched the others, but I know she is really good at coming up with practice questions and practice scenarios. Level Up RN, Nurse Kathy, she also does a lot of good practice questions, and she is really great at explaining things in simple terms. The next thing I want to talk to you about is kind of related to this box, which is where I keep my scrubs, is what you actually need to buy for school. Now, I hate to be the one to say it, but you absolutely need a laptop of some sort. A laptop, a Chromebook, an iPad that has like the typing keyboard attachment. You at least need that, especially when writing essays. My first year of nursing school, I wrote a 40-page case study. Secondly, an iPad is helpful. I'm a person who loves to handwrite things when I'm studying. Now, obviously, I could do this on paper, but the good thing about writing it on an iPad is that you can't lose it. Since I've been a senior, I haven't used my iPad as much, and I've found my laptop a lot more helpful during lecture. But definitely my freshman, sophomore, and junior year, I used my iPad almost every day. And I think that if you are a person who studies by writing things down, an iPad is the way to go. You never lose the papers. You don't have a chaotic backpack just full of miscellaneous papers. It just keeps everything very neat and organized. As for clinical, of course, you're going to need scrubs. You are probably going to be assigned university scrubs that you have to wear. I've never seen an undergraduate program and you're allowed to wear any sort of scrubs, and you usually have to buy them like through your university website. I would buy at least 2 pairs of pants and 2 pairs of shirts. And then I also would recommend buying under scrubs, which is just like a shirt that you can put under your scrubs. Most of the time, hospitals are very cold. I think it's more hygienic. I don't have any particular reason for thinking that. I probably have just as much germs as a person who doesn't wear underscrubs, but in my head, I'm not getting as much germs on my skin because I have long sleeves on. That probably makes zero sense, but I would recommend getting underscrubs. The next thing you're gonna need, a stethoscope. You do not need to get a fancy Littman stethoscope. You can buy like a $10 one off of Amazon. I have a Littman stethoscope because I wanted one. I got it for Christmas, but you don't need that. The stethoscopes that they use in the hospital are like the cheapest ones they could possibly find, and they work just as well, if not a little bit better, if I'm being honest. Okay, I had to stop for a while to charge my phone, but while I was charging, I continued my closet ransack. This is all the stuff that I'm giving away and all that stuff too. Yeah, all these were originally in my closet, but my closet looks just as full as it did before. Like, if not more full. What is this? If that tells me anything, it's that I have way too much clothes. But that's just my little intervention, and let's get on with the video. Another thing I would recommend getting besides a stethoscope is a pen light, and specifically a pen light with the pupil sizes on it. That way, if you ever need to look into your patient's eyes and chart the size of them, you have it real handy right there. The other day I was in clinical, and the nurse just flashed her like phone flashlight into the patient's eye. And was like, yeah, they're fours. I was like, oh my gosh, maybe she's just really good at this and is a pro and has done it so many times that she can just see the size based off looking at it with no measurement. But if you want to be exact, I would just get a pen light with the pupil sizes on it because it's better to be safe than sorry. Next thing is bandage scissors. I can't even count the amount of times where I've been in clinical and then we're doing a dressing change and the nurse is patting her pockets like, oh, I forgot my scissors. Do you have some? And I usually do. So that way you can be the cool nursing student that has scissors on them. That way the nurse doesn't have to walk out of the room, get the scissor, walk back into the room, and then continue. So you'll thank me later. You'll also need to get a badge reel. You always have to have your badge identification on you. My university isn't particular about what badge reels we can have. We can have any badge reel we want, and mine is Squirt from Finding Nemo. There's this dude on it. It's super cute. I've gotten so many compliments on it. But yeah, you can get a pack of 10, a pack of 20 badge reels off of Amazon for super cheap. So yeah, get some cute ones and it might brighten a patient's day. A lot of people have fold up clipboards that literally fold up and you can fit them in your pocket. I'll put a picture of what mine looks like. I wouldn't say that it's a necessity, but it is nice to have because a lot of them have like lab values on them, or like different sorts of information, pain scales, etc. And it's also nice if all the desks are taken, you can write while standing up, especially in instances like when you're doing rounds. A lot of times the whole team of a patient is standing outside of the patient's room just talking about what recently happened with the patient, what's the patient's diagnosis, and so on. And that happens every day. So a lot of times there's nowhere to sit, and most times as a student, you're not going to have a desk. So you can just open up your clipboard and write while standing up. That way you're still getting down all the information you need, and you're not stealing a desk or in someone's way. This one sounds obvious, but please get a backpack. You do not need to get a special bag for clinical or a tote bag for clinical. You're gonna have your computer in it, your stethoscope case, your pen lights, your pens, pencils. You do not want to be lugging that around on your shoulder. Your backpack that you use for lecture is going to be just fine. Some textbooks are necessary, and if you can afford it, I would recommend getting the ebook version. A lot of times the ebook version is cheaper anyway. You're going to be writing papers. You're going to write at least one paper a year, if not more, throughout nursing school, and you have to cite those textbooks. And the reason why I recommend ebooks is because if you know the hack where you press Control F search and you can type in a specific keyword and it'll show you where in the textbook it has that keyword or has that topic. Whereas if you have a physical textbook, you don't have the Control F option. You have the index, but then you're like flipping back and forth through the pages. Now, I'm not saying find free PDFs because it might be on some sketchy website and you might get hacked. But I'm just saying, I got free PDFs and I never got hacked. So do with that what you will. Be cautious. If you can find a free PDF of the specific textbook you need, good for you. Moving on. The last thing I was going to mention, which I already somewhat touched on, is that, again, we are in a day and age of artificial intelligence, and I would use it to your advantage. There are so many different platforms you could use. Me specifically, I mostly use ChatGPT and Google Notebook LM. I feel like I like Google Notebook LM a little bit more because it's more specific to just the information you put into it, whereas ChatGPT can use Google and pretty much anything that's been put on the internet. It pulls from that. But with Google Notebook LM, you input sources. So you can input your PowerPoint, you can input your textbook or certain pages of your textbook, you can input your worksheets, whatever assignments you get, whatever textbooks you get or information, you download it, input it into Google Notebook LM, and then you can say, summarize this for me, explain this to me, make practice questions for me. And it's not just pulling from a random thing off of Google from 20 years ago. It only pulls from the information that you give it. So I find that to be really helpful. It's not cheating, it's simply just using AI to your advantage to make your studying easier and more efficient. ChatGPT is nice also to make practice questions. And you can, if you pay for it, you can insert, your PDFs, your textbook, and then say, summarize this. I'm just a little more cautious with ChatGPT when using that as my definitive answer because I know that it's not always 100% accurate. Whereas with Google Notebook LM, I know that if it's on my PowerPoint, it's only going to summarize things off my PowerPoint. So that's just my little tidbit on that. Yeah, I think that's everything that I would have wanted to know before I went into nursing school. If you have any questions, please feel free to comment them down below. Let me show you guys the finished product of my closet ransack. Okay, so in here I got my dresses, all my sweaters, tank tops, short sleeve, long sleeve jackets, sweatshirts. And then these are all folded and organized. I've got more like crew necks and sweatshirts in there. I've got my fancy dress pants in here, workout clothes, scrubs and under scrubs, pajamas. I've got t-shirts in here, and then I've also got swimsuits and shorts, sock drawer, bras and underwear, my shoes that I wear most frequently. Put the rest of my shoes down there. This looks like it won't close, but it will. Boom. Also cleaned up all the mess that was in here. I'm probably gonna take my bags of clothes and take them to Goodwill or donate them, just so that they can go to another use. But once again, thank you guys so much for watching. I hope that you liked it. If you did, I'd appreciate if you hit the like and subscribe button, and I'll see you in the next video.